Visible?
Yes, sir.
Not a slide, so resume slide. Okay, I am not able to do it in the regular way. So you can read all these things. Faster mnemonic to identify and check key aspects in the critically ill patient. And this was later modified. Initially, it was only fast hug. Then it became fast hugs, BID. So later modification was this adding S to hug and BID. And there has been several modifications based on the mnemonic. And the faster maidens is a mnemonic used for identifying drug-related problems in ICU. These medications, antimicrobial, you can see this slide here. And the mnemonic reduced the medical and surgical patients. These are the changes that they have been made. Here it is feeding, whereas in surgical patients, sometimes it may be nil by mouth, and you have to do enteral feeding. And analgesia using Vascor, especially for surgical patients, is mainly because of the post-operative pain. Whereas in medical patient, it is for the tolerance of endotracheal tube, enteral feeding, or the central line procedures. So the analgesia indications are little different. And whereas in the surgical patient, you want to keep the sensorium more awake by using all the scores, whereas in a medical ICU, patient may be on a ventilatory support, so you have to keep them sedated. And in surgical patient, apart from thromboprophylaxis, temperature control is also very important, because post-op temperature increase is an indication of early indication of infection. So the acronym stands not only for thromboprophylaxis but also for temperature and tube. And head up after hemodynamic stability. She correctly insisted on that. Do not give head up for all patients. If they are hemodynamically stable, then you can do that. And ulcer prophylaxis and the urine output is very important in surgical patients, because in the post-operative period, you will be depending on IV fluids. And the glycemic control is important for both. And spontaneous breathing trial for patients who are on a ventilator in medical patients, whereas surgical patients, they may not, all of them may not be on a ventilator, but they may require supplemental oxygen in the form of mask or NIV or high flow oxygen. And bowel movement, of course, in medical ICU patients, you have to watch for the normal bowel movement. Whereas after abdominal surgery, you expect some amount of ileus or gastroparesis, and you have to watch for the normal bowel movement onset. And indwelling catheter, of course, it is the same. Try to remove them as early as possible. And drug escalation, you can go for not only the antibiotic de-escalation, but also the painkillers and sedatives to be de-escalated as early as possible, so that you get a fully conscious patient and you are able to do that. So the acronym has been expanded here, and somebody has made it fast hugs in bed, please. Instead of BID, this expansion gives you all these changes. Here, fluid therapy and feeding, analgesia, antiemetics, and anti-DVT prophylaxis, and sedation, spontaneous breathing trial. Tetanus prophylaxis also included in T, head up position, ulcer prophylaxis, glucose control, skin and eye care, and suctioning. Instead of spontaneous breathing trial, another specialty has converted this expansion into skin and eye care, indwelling catheter, nasogastric tube, bowel care, environment, temperature control, de-escalation of drugs, and psychological support. This also is a very, very important thing that has been important, because all of you know the post-traumatic stress disorder is a very important complication which prevents the critically ill patient recovering faster. So somebody has modified this into fast hugs in bed, please. And these are all the individual things that what will happen if you don't give proper feeding to these patients. They have increased susceptibility for infection, poor wound healing, bacterial overgrowth in the GI tract, increased chances of decubitus ulcer, and prolonged ICU and hospital care. So how to correct that is also given in the bottom portion of this slide. Then analgesia, you can use visual analog score, or there is a scoring system called critical care pain observation tool, CCPOT, which takes the form of facial expression. Because if a patient is intubated and on mechanical ventilation, they will not be able to use this VA scoring system. So you go for facial expression, body movement, compliance with ventilator, muscle tension. All these things are used for assessing the need for the analgesics. Then this sedation depends on what is the type of patient. You can use the GCS or Glasgow scale or the Richmond agitation scale for assessing the requirement for that. And for thromboembolism prophylaxis, she mentioned all these things, how to go for that graduated stockings and the sequential compression device and pharmacological agents like low molecular weight heparin. And then head up elevation, ulcer prophylaxis, all these things she mentioned. And glycemic control, spontaneous breathing trial or supplemental oxygen as you may have in the surgery patients, and bowel care and indwelling catheter, drug escalation, all these points you know that. So these are all the things that you have to remember for this mnemonic. So it is primarily a mnemonic for generalizing all the points that you have to take care in a critically ill patient. Okay. So that was a good presentation by Yogika.